Hi, my name's Kelly Forbes, Senior Mental Health Practitioner with Newry and District GP Federation, and today we're talking about perimenopause and menopause. So just some key terms before we start, because I got confused quite quickly whenever I started looking at this topic. So let's look at the key phases. Pre-menopause is from when a girl has her first period up until when the periods start changing, which is usually around mid-40s. And what tends to happen in the mid-40s, we're calling this perimenopause, is when the cycles start changing. So they can become shorter, longer, there can be more pain, less pain, heavier bleeding, lighter bleeding, but they will start changing. We then have menopause, which is a date in the diary which signifies that you have not had a period for 12 months, a single date in the diary. I heard a GP say a while ago that menopause is like puberty but in reverse. So a girl may have her first period, again that's a date in the diary, but there would have been a lot of changes leading up to that. There would have been breast growth, there would have been pubic hair, there would have been changes in mood and sleep, in body temperature, body odour. So all of that would have happened, and it's the same the other way round. The date in the diary is 12 months post the last period, but a lot of changes leading up to that before that. Wanted to mention medical and surgical menopause because this one isn't talked about as often. So surgical menopause, if a woman has her ovaries and womb removed, that will plunge her into menopause overnight, and that can be terrifying if that perhaps hasn't been talked about or the woman isn't prepared for that. And then the medical menopause is if a woman is receiving treatment for cancer, possibly chemotherapy or radiotherapy, that impacts ovary function. So that can bring on an early menopause as well, so to be aware of that. And then post-menopause, so this is your 12 months of not having a period. A day after that, you are then post-menopause. We're going to move on to thinking about the symptoms that happen through this transition. Now, the main hormones that are at play for a woman is estrogen, progesterone and testosterone, but it's the main player of estrogen that is responsible for a lot of symptoms as we go through this transition. I like to think of estrogen as like a general manager in a woman's body. It has so many roles throughout a body, and during perimenopause and menopause, it's almost like the general manager has decided to go off on leave a few days or not be around as much. So imagine in the workplace, if the general manager leaves, things will probably still go on and tick over, but might not be as efficient, problems might arise a bit quicker, things might not go as smoothly, and it's a little bit the same whenever we have this drop in estrogen. I'm not going to explain every symptom as to why we have it, but again, this theme of there are estrogen receptors all over a woman's body. So the drop and the fluctuating levels will have a really big impact through a lot of the woman's body. For example, we have estrogen receptors in the mouth for the woman. So, and it's largely to kind of promote the flow of saliva. So again, if that drops, we don't have as much saliva, and that can be responsible for a dry and burning mouth, starting to get bad breath or gum problems because of that dropping level. And moving on to our gut, so there are estrogen receptors in the gut. So some women can get IBS, diarrhea, constipation. Again, if the estrogen is dropping, then that will impact the digestive process there. We're now going to pop up the common list of symptoms just to kind of talk you through some of these. So if I just run through them: heart beating quickly or strongly, feeling tense or nervous, difficulty sleeping, memory problems, attacks of anxiety and panic, difficulty in concentrating, tired, lack of energy, loss of interest, feeling unhappy, crying, irritability, dizzy and faint, pressure or tightness in the head, tinnitus, headaches, muscle and joint pains, pins and needles, breathing difficulty, hot flushes, sweating at night, loss of interest in sex, urinary problems and symptoms due to vaginal dryness. The next one I'm going to pop up is a picture of some brain scans, and this is the work by Dr. Mosconi, who has felt very passionately that the medical world has really talked about the symptoms in terms of a fertility change or what's happening with the ovaries. Dr. Mosconi has done a lot of research showing that these changes occur in the brain as well. And from this picture, what it's showing you is the change in energy levels throughout pre-menopause, perimenopause and post-menopause. And from this picture, you'll be able to see that pre-menopause, the lights are all on, it's a very energized brain. And then you'll be able to see that everything starts to just go, like the lights almost seem to dim. And then post-menopause, some of this comes back online again. The clear message that we want to give you is that there are clear biological and physiological changes happening for a woman throughout this change. This isn't witchcraft and wizardry and in a woman's head. The research is showing us is there are clear changes happening. I'm just going to read this next bit word for word because I want to get it completely accurate. The risks of menopause. The transition carries risks to a woman's brain and body health which cannot be ignored. The lowering hormone levels increases the risk of cardiovascular disease, osteoporosis, Alzheimer's diseases, clinical depression, and some types of cancer. So this sounds pretty scary, and the science is telling us that we're not saying that menopause is a medical condition or an illness, but we are saying the lowering hormone levels are putting a targeted strain on some of the major organs in the body. The research is telling us to manage, if needed, the symptoms as they arise, not to wait them out or endure them. So this sounds really simple then, doesn't it? I need to look at my symptoms as a woman and I will go and talk to that. I will go and talk to a healthcare professional, see what symptoms I'm having, how that can be managed, and then make some choices. We're women though, it's never easy, and it certainly doesn't get any easier in midlife. So here are some of the challenges. Challenge one, the symptoms aren't often seen as a cluster. They're often seen as separate issues. And we all do this, you know, I would have women coming in with me as a mental health nurse that they're saying, you know, I'm panicky, my mood's dropped. And it's only afterwards that I think, how old was that woman? You know, is this part of a general change as opposed to a specific change in mood? And again, women will probably ring up saying they have a UTI. And again, not really a further discussion. I'll get an antibiotic for that and kind of move on. So we're saying that we need to look at the cluster of symptoms for women coming into that age, into the mid-40s, and women themselves and us as healthcare professionals need to take responsibility for that. Issue number two is the fluctuation of hormones, and we're going to pop up another graph now which shows, and I hope that you can see from this graph, it's not a slow, steady decline, it's jaggedy, it's all over the place. Some days the hormone levels are higher than when we had regular periods, and other days they're plummeting. The majority of women did not know they were in perimenopause when they looked back. It's only with hindsight when they've looked forward. Davina McCall gives a really good example of this. She talks around having 2-3 nights of horrendous hot flushes. You know, the bed sheets were absolutely drenched, and then it settled, and then she didn't have anything for months after that. And as she did at the time, she went, well, I've just got a virus, haven't I? I've just got a virus that's kind of worked through my system in 2-3 days. I'm feeling a lot better now. So that one's really common. And then the next set of symptoms that you might get could be different. It might be more the mood element or the sleep element. So it is hard to join the dots. The next issue is about, there's not really an accurate test to say if you're in perimenopause or menopause. There's a blood test that's commonly done, it's the FSH level, but looking back at that graph, you will see that the fluctuations would make it very difficult to get an accurate reading on that level. And the guidance is telling us to treat the symptoms, not the hormone levels. And NICE guidance tells us that if you are actually over 45, that blood test isn't recommended. It's more about the change in the monthly cycles and the symptoms alongside that. So, and then the final issue that we're looking at is if a woman is on contraception. So this will make it really hard to determine if the cycles are changing. So if a woman is on the contraceptive pill, it's a withdrawal bleed on week 4. It's not a true period. The implant and the coil can make women stop having periods altogether. So again, it's just another part of the puzzle that makes it hard to unpick whether this is perimenopause, menopause, or something else going on. So what do we advise then? So number 1, get tracking, get a symptoms checklist and start tracking what's going on. Because if you go and speak to a GP, that lovely brain fog will kick in and they'll say, what symptoms are you having? When did you last have them? And the brain fog will go, I've no idea. You know, what's my name today? I have no idea why I'm even here. So get that evidence and track it week by week, month by month, because what a healthcare professional will want to know is what symptoms are you having? Every woman's different, there will be a range. How often are you having them and how severe are they for you? And that's what those trackers will be able to evidence for you when you go to speak to somebody. A lot of women have said to me, is this common? Is it just me? You know, I'm not able to get on with this. The research is telling us that this is more women are getting symptoms than not. So varied research, some research says that 10% of women only experience changes in their cycle. That's all they experience, lucky them. Other research is telling us that 99.9% of women will have at least one debilitating symptom of menopause. And other research is telling us that 70% of women are having symptoms that are really impacting their day-to-day life. So ability to work, manage the family, be at home, manage relationships, you know, really impacting day-to-day life. So when you go and speak to a healthcare professional with your symptom checklist, there likely will be a discussion about ruling out other conditions. So such as low iron levels could be contributing to low mood and low energy. An overactive or an underactive thyroid could be contributing to some problems. And in particular, if a woman is having palpitations as part of the presentation, then a doctor will probably speak to you about atrial fibrillation and having that ruled in or ruled out. The best indicator of age for when a woman is likely to go through peri or menopause is the mother. So if at all possible, if a woman can have a conversation with their mother around what age did you start going through perimenopause, menopause, and what types of symptoms did you have, and also the woman's own experience of other key phases in their life. So how was puberty for the woman? How were the monthly cycles? How was pregnancy, if pregnancy was the route that they went down? How was that postpartum period? Because if that was problematic, then it probably will be similar in the perimenopause blueprint as well. We also really wanted to mention we can't ignore that there is an increasing suicide rate for women in their early 50s, and we don't think this is a coincidence because this would be the key years of the transition and when the symptoms are probably at their strongest for women who are experiencing them. Similar changes are happening to the brain and the body in puberty and in pregnancy. And when we look at perimenopause, could it be that perhaps women are older and these changes take a bit more toil? Researchers are really saying what they're noticing is this isn't talked about as much. When you think about how much life is going on for a teenager, they've got the family around them, and pregnancy or a new child, and lots of services in there for postnatal anxiety and depression. Menopause is like, it's like witchcraft, wizardry and legend. You know, it's really hush hush, things aren't talked about, and part of this is about sharing this information with women so they're not feeling alone. The one that authors talk about is this shared experience for women of every woman through their perimenopause, menopause journey at some point will have this experience of burn down the house, I'm leaving with a suitcase and I'm not sure if I'm coming back. Women who are of that age will probably know what I'm talking about there. This really needs to be spoken about and normalised as part of this journey, because we've got few things at play here. That the hormone levels have dropped, so the day-to-day running of life and the functions of the body will not be running as easily. The other key hormone here is oxytocin, which we know as the love hormone. So this is the hormone that's produced when we're close to people that we love. It has a massive surge in pregnancy, and when the kids are young, so you know, it really helps us do all of the family life. In perimenopause, this hormone drops, so there will be this almost this lack of empathy and just not feeling like we're connected to people. And again, normalizing that, it because I think for some women this can feel devastating, like if I had a personality change or if I suddenly change my life values. No, again, there are clear biological and physiological changes happening that we really want to share with all women that are going through this phase. So let's finish on the positives. Now I've talked about the negatives. So we're going to pop up another graph here, and this is showing life satisfaction. So as you can see here, this is really dipping as we come into peri and kind of in the depths of menopause. But look at this on the other side. Things are really upping here. And other research is telling us that women, when they hit 60, they've never been happier. This is the happiest time in their lives. The neuroscience is backing this up as well. So Dr. Mosconi, who I mentioned earlier, she's been doing brain scans again. She's showing that whenever women are showed like negative stimuli, the parts of the brain that are responsible for more of the negative emotions just aren't lighting up as much. So not as bothered by things that might have bothered women in their younger years. And again, the areas that promote joy are much higher. Also areas of the brain that are linked to empathy, they're all much higher again. And again, this is a transition. We're moving into a new normal. And I think the new normal is about eldership, it's about wisdom, and it's not a coincidence that younger generations will seek the wisdom of older women. Again, the brain changes are showing that as well. We're also kicking out monthly cycles for women that have had years and years of horrendous PMS or soreness or migraines, bleeding, needing tampons, pads, going, oh no, I've just come on and I wasn't prepared for it. We get rid of all of that. Able to enjoy sex without thinking that fear of pregnancy as well. So there's a lot to be gained, and the shared experience for women is this term menostart. So a lot of women are talking around this stage in life is more about them. Perhaps the children are grown and have flown the nest. And this phase is now thinking about what's important to me. What do I want to start doing now that I've reached this stage in life? So the final message, treat the symptoms if needed. Do not wait them out or endure them. We've prepared a handout on this talk. Here it is. We're going to link it in the description so you've got it as written information if you would like that as well. And I've talked about all the resources that I've used from this talk. Dr. Mosconi, Dr. Newson, Alexander Pope and Sajani Wurlitzer from their Wise Power book. But if you've got time, pop over now to our Managing the Transition, and we're going to talk about the evidence-based treatments.